So the next medication that I have a real challenge with is kids on ADHD meds. It was reported recently in one of the major leading newspapers, the United States business newspaper, that there was a shortage of Adderall. A shortage. Now imagine what I just said to you. There was a shortage of a drug that's used to treat ADHD. We shouldn't even have ADHD in America, and they ran out of drugs. 25 million prescriptions, by the way, just for ADHD meds in 2009. 45 million meds for asthma. And then we can keep going with the diabetic type of medication. And once again, we are not telling anybody to go off their meds.
No.
But we know that diabetes is the third biggest killer in our society today. Third biggest killer. Most diabetics are overweight. Not all overweight people become diabetics. So we talked about statins. 50% of the women who are menopausal who take a statin drug will become diabetics. 50% of them will get dementia. So when we talk about Dr. Bob's ABCs, I'm not playing around. So cholesterol elevates not just because of food. So it's not just because of dairy and red meat. I don't even talk about that when I tell people to lower their cholesterol. The leading reason for high cholesterol, subpar thyroid function, stress, sugar, and trans fatty acid. Trans fatty acid, or partial hydrogenated oils, cause inflammation in the body. That inflammation causes your cholesterol to go up because your cholesterol makes cortisone. Cortisone is the water in your body, figuratively, that puts the fire out. So cholesterol is really not good or bad. Cholesterol is like a fireman. Okay. Firemen put out fires. High cholesterol. So if you go into a healthcare provider right now and your LDL is high, see, cholesterol cannot float in blood because cholesterol is an alcohol. So it needs a truck. The truck that takes the fireman to the fire is the LDL truck. So if you need a lot of stress and you go into your healthcare provider and you have pain in your body and your cortisone is low, your brain will tell your body to make cholesterol first, then pregnenolone, and then progesterone. Progesterone becomes cortisone. I know people are going to watch this tape more than one time. So the progesterone will make cortisone. But if your LDL is up, because all the firemen are going to the fire, your healthcare provider, from his due diligence, will put you on a drug to lower the LDL. Nobody ever asks what's causing the fire. The fire is caused by sugar, trans fat, and one of the biggest foods in America that people are passionately addicted to is ice cream. So when somebody comes in my practice and they have a high LDL, I have them do a diet sheet. I want to see what they're eating. And guess what they're eating? Everything I just told you. So we could eliminate a lot of medications just by empowering people to make wise choices.